Tucked away further north in Acholi region is Lamwo district. Carved out of Kitgum district in 2009, it has a population of over 178,000 people. In 2012, about 500 children in the district started showing peculiar signs and symptoms of what was later diagnosed as nodding syndrome.
We found that out of these 548 people affected, 351 were actually nodding syndrome cases.
The LC5 chairman Matthew Akia Ochen, who also chairs the district task force on nodding syndrome, says 197 were found to be epileptic.
From the time government of Uganda came in through the Ministry of Health to support this program, we have been able to receive a total of 158 million shillings, 35,000.
This has been used in setting up the district task force, training medical staff, as well as setting up outreach centers.
Out of the 9 sub-counties and 2 town councils, the most affected sub-counties are Palabegem, Palabekal, Palabekogili.
All sub-counties near River Achwa and other rivers known to harbor the black fly, which is believed to be one of the many suspected causes of nodding syndrome. We visited a Bam village in one of the 3 most affected sub-counties, which is 39 kilometers away from the nearest health center.
As I talk now, some of them have died. Others are now improving. Others are not yet improving.
The district established 12 outreach sites where the medical team goes regularly for assessment and referral where necessary.
There's no single health facility?
No.
I know it is really needed, but at the moment, what are we doing to cover that gap? We cover it through integrated outreaches.
Can go and carry out immunization there, nutrition assessment, antenatal care, then postnatal and testing of blood. Then we also bring in the giving of their refill.
But when the refills delay,
sometimes it forces the parents to move up to the health center, that's Palabengem sub-county, to get the drugs for the patients.
The unmonitored children then wander off, some to their deaths.
Here we have one case in this parish, in another parish, that's Game Parish. Also, one patient died in the same manner.
Their bodies were found in the bushes. Patrick Olal, the LC3 chairman of the most affected sub-county, says that some parents no longer tend to their gardens, yet most are impoverished. The free food supply has become irregular.
Very, very irregular. But our idea was that we need to have a sustainable system in place. So that would mean providing them with seedlings, giving them probably ox traction, so that they're able to plow, to cultivate their own foodstuff instead of relying on food handout.
The district authorities report progress with no new registered case since March 2013. No one represents this success like this 3-year-old. She started showing signs of the syndrome when she was just 1 year and a half old. Lucky enough, the interventions came during that time. So she's now faring better. Same applies to these people here. They are adhering to their medicines, which is something that is keeping them in shape.
More than half of them have managed to go back to school.
But of course, there are a few others who are still having some challenges. But we also appeal to the community to give all the support, the care.
Akia says that psychiatric officers in the district are expected to go to the schools to make further assessment.
Some of them are slow learners because of the mental retardation, and that would call for establishment of rehabilitation center and special needs education to be provided to such category of people.
For those children who are not going to show signs of recovery permanently, we should rehabilitate them and provide them an alternative life.
Overall, Lamwo has emerged the best district in dealing with nodding syndrome.
The commitment of the leadership, the commitment of the technical staff, the health staff, and also the compliance by the community.
But questions loom.
What is causing nodding syndrome?
How long is the treatment going to take? Because because we know this is managed just like epilepsy is managed.
It is very strange, very strange.
The people in Lamwo are not yet at home in their minds about a syndrome that just won't go away. Florence Naluyimba, NTV Lamwo District.